So let's start. Ladies and gentlemen, thank you very much for coming this morning. It has been a very interesting day yesterday with the students present their poster. They were very interesting poster. We get introduced to ourselves, and please get in touch, talk a lot, and to create the group tomorrow for the hands-on session and the labs. Today we have a full day pack of presentations, and I asked the speakers to present in very short time. They will have 15 to 20 minutes to leave enough time for you to interact with them. Then Bogdan will be sharing the session, and he will challenge you to challenge the speakers. So, but be careful, Bogdan. So
we always are.
Yeah. Just to give you just a sort of context, where we are here, we represent the future medicine in the human brain project that has these three branches, which is the neuroscience, understanding of neuroscience and how to compile all the knowledge that has been accumulated through the year in this simulation. And by simulation, it means a model that can predict the data, explain the data, extrapolate, and define a new way to compile all this multi-scale understanding. Future computing is obviously important because you have to run this in a supercomputer, and future medicine will benefit from this. Then today you will hear from the first session what are the challenges in medicine and why we need this radical change of strategy in order to explain brain diseases. And the session after, you will have presentation of new innovative ICT technology that can provide us the way to go forward, and we have a presentation of IBM Watson, which is also a way to combine this cognitive intelligence in understanding the brain. And this afternoon there will be all presentation dedicated to data mining. Because of the sake of time, I will skip again my presentation. But the HBP approach is this idea that you can build collaboration among scientists that look at the same data from different points of view. From neuroscience data, mouse to human. And really to build this closed loop understanding of the human brain, and really to get this knowledge what you get from mouse at different level, to understand what's happening in the human brain at some level that you cannot have access to. And the strategy, of course, is to go toward personalized medicines. So I will go very briefly. Then the idea again to the human brain project is really to get the researcher that's working in different scale of the brain to work together. And for example, as a psychologist, a neuropsychologist, we know a lot about the behavior. And now thanks to neuroimaging technique, we can map this behavior to the human brain. And we can also go at the brain region level, and we can then go down. At a certain level of this representation, they are completely inaccessible in the living body. And this needs a sort of new approach to get this causal modeling approach where you can infer or reverse engineer this level, which is important. And this level that are important is what's happening at the synapse, at the cell, or the microcircuit. And it's there where the treatment will be effective. And if you have this understanding, you can build stratification of subjects based on this important level. So this is the information that we need in medicine, but unfortunately is not accessible. So I explained yesterday to you this concept that we have about disease signature, and how in the first step we will try to gather information that is accessible now in the human brain, and bring that together and to build predictive model of symptoms. And Richard Frakowiak will explain why this is very important. Future medicine, then we expect from you on Tuesday to help us to build this new and novel tool for scientists to mine the clinical data. You will have at your hand clinical data that are PET imaging, clinical symptoms, and how to combine them, and to think how to build these data mining tools, but really driven by your understanding and your knowledge about the importance how to stratify patients. So, without no further ado, I think I will stop maybe here and leave the space to Bogdan. Okay, introduce the speakers and start the session.